You're welcome. Let's talk about throwing up blood or vomiting blood. Throwing up blood is often a sign of abnormalities or malfunctioning of the organs along the digestive tract, like the stomach, the esophagus, or the beginning of the intestine. It is a symptom that is commonly associated with gastritis and ulcer. Vomiting blood is medically referred to hematemesis and can vary depending on severity. Patient may report small or large amount of blood, both of which should be reported to a doctor. Throwing up blood can be a sign of various health conditions, such as esophageal varices, which are blood vessels in the esophagus that have become dilated. They are not strong again. This can happen due to obstructed circulation within the hepatic portal, which is responsible for draining blood around the abdominal organs. With decreased blood flow or obstruction in the hepatic portal, pressure in the vessels around the esophagus will increase. And this increased pressure causes dilation and subsequent bleeding. It can be gastritis. Talking about gastritis is characterized by inflammation in the stomach, which occurs when the protective mucous lining is destroyed and is left untreated. Without mucous lining, the stomach is prone to developing ulcers, which can bleed over time and lead to bloody vomit and dark stools. Number three is esophagitis, which is an inflammation that affects the esophagus, which is a structure that connects the mouth to the stomach. Your stomach is to the left. So most time esophagitis is caused by infections, gastritis, or reflux of acid. People with esophagitis usually have excess acid in their esophagus, which can cause symptoms like heartburn or bitter taste in the mouth, a sore throat, and blood in vomit. Then, of course, there is stomach ulcers, which mostly occur due to chronic gastritis. That's inflammation of the stomach that is left untreated. Stomach tissue that is constantly irritated by stomach acid can lead to the appearance of ulcer. Then we have gastroesophageal reflux, GERD, is the backflow of stomach content back into the esophagus towards the mouth. This condition causes constant pain and inflammation of the esophageal wall, and in severe cases, it can also cause bleeding and the appearance of bloody vomit. Then, of course, we have nosebleed. When nosebleeds are very intense, the person may involuntarily swallow blood and then feel the urge to eliminate it by vomiting. You understand? Most times, throwing up blood after a nosebleed, it is not serious. However, you should monitor your symptoms, how often this happens, and how much blood you lose. You should see your doctor if you vomit frequently after nosebleeds. Number seven is chronic pancreatitis. Chronic pancreatitis is the progressive inflammation of the pancreas, which is just right behind the liver, which can cause blood vessels around the pancreas to rupture and result in bloody vomit. It can be as a result of liver cirrhosis, which can also lead to vomiting with blood, as well as yellowing of the eyes, the skin, dark urine, whitish stool, or swelling of the legs, especially when it is in the most advanced stage. So check out liver disease symptoms, before to determine whether your symptoms are related to a liver problem, and consult your doctor as soon as possible. Number nine, we have Mallory-Weiss syndrome. This is a condition in which there is a sudden increase in pressure in the esophagus, which can cause the tissues that joins the stomach to the esophagus to rupture. And when it ruptures, some symptoms of this may include throwing up blood, serious abdominal pain, chest pain, and all that. Then 10, portal hypertension. And when we're talking about portal hypertension, is the increase in pressure in the portal vein that carries blood from the abdominal organs to the liver. This can alter its functioning and cause bleeding, leading to what? Throwing up blood and very dark, foul smelling stools. And of course, we have cancer, the presence of stomach or esophageal tumors can lead to blood being eliminated through the mouth. This symptom is more frequent in advanced stages of cancer. In addition to throwing up blood, you may also notice other symptoms like loss of appetite, loss of weight, difficulty swallowing, dark stool with a foul odor, a feeling of a full stomach, excessive fatigue, and abdominal discomfort. Whatever you went through, you don't understand, kindly see your doctor. See you in the next video.